Not getting a good night's sleep and wondering why? Coming up on Being Well, we'll talk with sleep technologist Rodney Wildman from Sarah Bush Lincoln Health System about common sleep disorders such as apnea and restless leg syndrome. Rodney will also give us some tips for getting a better and more restful night's sleep. That's just ahead on today's edition of Being Well, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. Well, if you've got sleep issues and sleep questions, we're going to get a lot of them answered today on Being Well. That's because I have Rodney Wildman, who is a sleep technologist with the Sleep Disorder Center at Sarah Bush. Thanks for coming in today.
Thanks for having me.
All right, so tell us a little bit about what you do at the sleep clinic.
Primarily, I run the nighttime diagnostic sleep studies on the patients when they come in to be screened for sleep apnea and other sleeping disorders. And then occasionally on days, when I do work days, I will contact the patients to make sure they're still compliant with their CPAP and make sure they're not having any issues. And if they are, well, we'll bring them into the sleep lab and we'll try to work them out with them.
All right, so we're going to talk about that sleep lab and preparing for a sleep study kind of at the end of the show, but you also run the Awake Support Program. Talk a little bit about who's in that program and kind of some of the issues that you guys talk about.
People that usually come to it are the CPAP users,
okay,
and their spouses, so that way they can get a good night's sleep too. And some of the issues, we try to talk about just the main issues that are affecting the group. For, say, like the last time we had the Awake group, at the end of it we say, okay, what topic do you want to talk about next time? And whatever the majority is what I'll usually talk about. Actually, I brought a flyer for our Awake group.
With the guys yawning at it. We don't want to be yawning. We hope today's show is not going to put you to sleep. We're going to find some ways to get people better night's sleep. But let's talk in general, how big of a problem is lack of sleep here in our country?
Lack of sleep is a real big problem. I mean, if we don't get a good night's sleep, we don't function well during the day. We don't do our job at the ability that we should be doing it. And then general safety comes into play too, and along with the health issues that come along with poor sleep.
So talk about some of those long-term health issues that come along when you don't get good sleep.
If you don't get good sleep, I mean, your body's not going to restore like it should. So, I mean, type 2 diabetes comes into play, high blood pressure, strokes, heart attacks, because our body isn't resting, so it's not recuperating like it should.
And why do they link obesity to lack of sleep? You'd think it would be the opposite.
But then a lot of times if we're not sleeping well, we don't feel like doing much during the day, and so then we may just sit there and, okay, a lot of people feed their depression by food.
Okay.
You know, so I mean, that's not a good thing, and that's where you don't sleep, your body doesn't restore and generate itself, so you don't feel like doing anything, so you're just in a loop right there, and it's real bad.
So let's go through how much sleep. We'll start with children, teenagers, and adults. How many hours of sleep should children have?
Okay, 0 to 2 months, they should be sleeping from, say, 10 and a half hours to 18 hours a day. And children, say, 2 to 12 months, 14 to 15 hours. And children 3 to 5 years old should be getting 11 to 13 hours of sleep. And then 5 to 12 should be getting 10 to 12 hours. And then adolescents, upwards of 9 hours if they can. I know they're real busy with all their electronics and their classes and extracurricular activity.
Well, I've seen, on the news, they're starting to think that maybe school should start later because
kids need that extra sleep and they're not as productive when school starts so early in the morning.
The kids are going to hate me for this, but then all they're going to do is stay up later.
So as we get into adulthood, how many hours of sleep should our average adult get?
7 to 9 hours.
Okay.
Some people function good on 6, but 7 to 9 hours, whatever works best for you.
And why do some people function really well on, that 6 hours and others just can't? I can't.
That's just the thing. I mean, we're all different.
Mm-hmm.
I mean, some people function good on 6 hours, and I don't. But I mean, some people do. But 7 to 9 hours is what all the sleep experts say to 7 to 9 hours.
7 to 9. Let's talk about some of the bad habits that we get into that might be causing not necessarily a sleep disorder, but occasional poor nights of sleep.
Electronics in the bedroom. That's the biggest one. TVs, get them out.
Okay.
No TVs in the bedroom, no electronics, keep your phones away. Another thing is clock watchers. Take your digital clock, turn it around where you can't watch it. Because a lot of people, oh man, I've only been asleep for half an hour.
Or I've got to get up at 5 and now
Right.
I've only got, that's terrible. I hate that.
Yep.
So digital, what other things? What about our activity level? Should we do a workout before we go to bed?
Not right before you go. I wouldn't work out right before you go to bed. Exercise is going to help you sleep better anyway. It definitely is. But I wouldn't do it, say, at least 3 hours before you're going to go to bed. Try to get it done early in the day. That way it gives you energy throughout the day and everything. Then when it is time to go to bed, you're relaxing and you're going to bed instead of your heart rate still being all amped up because you just ran 3 miles.
Right. What about eating and drinking before close to bedtime?
A light snack, just fine. Nothing spicy or anything like that. And definitely avoid caffeine. I would say probably 6 o'clock in the evening would be the last time.
Oh boy.
I don't.
I'm
I personally don't have any caffeine after noon.
Okay.
So
So what about for people that say, well, the caffeine doesn't really affect me?
you may not think it affects you, but it affects your sleep.
Okay.
It's going to make you arouse out of your sleep. You're not going to remember your arousals, but not like an awakening would, but you're going to start your sleep cycle repeatedly all over instead of staying a good consolidated sleep.
Okay. So even people say, well, I have decaf coffee at 9 o'clock and I'm going to go to bed at 10.
It still has caffeine in it, and it's still going to arouse you out of your sleep again. You're just going to keep starting your sleep cycle completely all over again.
So if you can you explain what the sleep cycle is?
Okay, whenever you go to sleep, you got stage 1 sleep. That's where you're drifting off, and you can probably still hear stuff around you. And then you get into stage 2 sleep, which is a deeper sleep. And then you get into the delta sleep or the slow wave sleep, which is one of your deeper stages of sleep. And then you get into your dreaming sleep, your REM sleep, your rapid eye movement sleep.
So if that caffeine is disrupting your sleep, is it disrupting you out of stage 1, stage 2, or can it be any of those?
It could be any of them. Yeah, you could have spontaneous arousals just out of any of them.
Okay.
Yeah. But once we get into, usually it's more common in 1 and 2. And once you get into stage 3, a lot of times we'll just cruise right through that. But the thing about stage 3 sleep is the older we get, the less we have a stage 3 sleep, and that's where our body does all the restoring and repairing of our body.
You brought up a point. The older we get, why is it the older we get, we seem to have, in my mind, less quality sleep than we did when we were kids?
Well, when we're kids, like I was just saying, the delta sleep or the slow wave sleep, that's when we're repairing our bodies and everything. That's like whenever you go pick up your toddler and they're just limp and they can't remember how they got from the couch to the bed. Okay, that's the slow wave sleep. And as we get older, we don't have near as much of that. We tend to dream more, which is what restores our brain, so that's a good thing. And but we just don't have the slow wave sleep to repair our body and everything.
Okay. And the older we get, you have to get up more and go to the bathroom, things like that. Aches and pains, you roll over.
Right.
So
a lot of times people think, well, I go to the bathroom 5 times a night. Well, you go to the bathroom because you're awake, or do you go to the bathroom because you really need to go to the bathroom? I've had lots of people do that, and they have horrendous sleep apnea. And they come in a sleep lab, and we put them on a CPAP, and they're fixed.
Okay.
They get up. I had one guy get up 9 times in 7 hours.
Wow.
And then he came back for a or a CPAP study. He got up once.
So his sleep apnea was waking him up thinking, oh, I have to go to the bathroom
Correct.
and getting up.
Right.
That's interesting. Well, we're going to get into some of these sleep disorders. Talk about kind of the common ones that you see come through this sleep center.
Of course, the biggest one is sleep apnea. Okay, that's a cessation of breathing. You stop breathing, completely stop breathing when you're asleep. And it's more prevalent when you're on your back.
Okay.
And so I've seen people on their side still have it just as bad, but it's more prevalent on your back. And then we have people come in for restless legs, which is the uncomfortable, tingling, twitchy feeling in your legs right before you're dozing off to sleep or relaxing for the evening. You know, you just feel like you got to keep moving your legs and or feet and stuff. And then we have periodic limb movements, which is whenever your feet, mainly your feet, will move while you're sleeping. So it can be treated with restless leg syndrome medicine, or it can be treated also with medicine for, say, Parkinson's or other kind of muscle relaxers and stuff like that.
So is that sudden jerking movement in your, or is that something different?
The suddenly jerking movement is usually, a lot of times that's associated with sleep apnea, but because that's your brain awakening your body saying, hey, get me some air in here. But the funny one that is when we're just maybe dozing off to sleep and we jerk. That's called a hypnagogic jerk. It's a perfectly normal thing to do.
Okay. So we've got, what about narcolepsy?
Narcolepsy, okay. We test for that there also. What will happen there is you'll come in for a full night overnight sleep study, and then the next day you're going to go through a period of 5 different naps throughout the day. And so if you start dreaming in any of them naps, that's going to be a positive sign for narcolepsy, which means you can just fall asleep at the drop of the hat and just start dreaming. And it's very dangerous, it really is.
Yeah, it would be, especially if you're driving a vehicle.
Or even eating. Yeah.
Well, since we know a lot, we forgot about insomnia. That's the other one.
A lot of times what we see is people write down they have insomnia on their history that we get from them. And a lot of times it's sleep apnea. But sometimes insomnia, you know, an occasional bad night's sleep, that's not really insomnia. If it starts involving your safety and your health and stuff like that, that's definitely a time to talk to your doctor about getting a sleep study done.
So is insomnia just the inability to sleep?
Right.
Okay.
Right.
So when does a sleep disturbance really turn into a disorder that's, you better do something about it?
When it starts impacting your health and your well-being.
Okay. Well, let's talk about sleep apnea, because I know that's a lot of the people that you talk to, and a lot of people I know have sleep apnea. Let's get into what exactly that is, and what are some of the signs that you may have it?
The signs that you may have it is if you're snoring. That's the first one. It's common to snore, but it's not normal.
Okay.
And that's a big misconception. And then if you're waking up gasping or choking, that means your airway's blocking off, and that's your brain waking yourself up, and you're making all kinds of racket and everything and disturbing everybody else in the house. And just poor health in general. I mean, you feel like your health is just going downhill. You know, you could have high blood pressure, type 2 diabetes, and heart attacks and strokes.
So, sorry.
Them are all signs that you could be having some sort of sleep apnea.
So the person that has sleep apnea, did they quit breathing completely?
Completely. The airway's completely blocked off.
For how long?
For us to score it as an event, it has to be a minimum of 10 seconds. And I've seen them up to 2 minutes.
Wow, that's amazing. And then on average, how many of those can someone have over the course of the night? Have you seen?
A lot. The way we gauge it is called an apnea-hypopnea index. It's how many times you either have an apnea or hypopnea in that hour, say an hour, say a 7-hour study. Okay, we take the average. I've seen anything up 70, 80 times an hour.
Oh my goodness.
Right. That's more than 1 a minute.
Yeah. No wonder they're not getting any sleep.
Right.
Are there or do men have it more than women? Is there a certain age group that sleep apnea affects?
It's typically more men because our necks are thicker than women's. But I mean, in the sleep lab, we see probably maybe half and half. You know, I mean, but it's not gender specific really. It's just the anatomy we get from our parents is where it comes from.
Okay.
So if our parents were snorers, there's a good chance that we might be.
So what is the deal with the neck? What does that have to do with the apnea?
Well, when we lay down on our back like we should and go to sleep, everything from our stomach goes to our chest. And then our chest goes up to here. It has nowhere else to go. So then gravity starts pulling everything back and it starts blocking off the airway.
Okay.
And that's where we start snoring and having the gasping and choking.
So people that are heavier are probably more apt to have sleep apnea as
They're
well?
more apt to. That doesn't mean they're going to. I mean,
Okay.
but they really are. I've seen people that are 6'2", weigh 170 pounds. They have apnea like crazy, and I've seen 400-pound people that just snore just a little bit. it doesn't make any sense.
So
to me.
what, you brought up snoring is not, what exactly is snoring? I mean, what's...
That's your airway starting to block off. And that's the air being forced through your airway, and it's causing the vibrations and the snore.
Okay. And most people are in denial that they snore.
Yes,
I've
they
been told
are.
that I snore, but
Yes.
I don't. Someone will have to record it, I guess.
We can do that for you.
Okay. So if someone thinks, okay, I'm having these symptoms, what should be their next step? Or maybe their significant other is saying, you're snoring a lot, we need to do something, and you're having all these other symptoms. What should be their next step?
Talking to their healthcare provider.
Okay.
Yep, definitely.
And, like, what should they say?
Just flat out tell them, say, my spouse says I'm snoring and I'm not feeling rested in the morning whenever I get up. Can we schedule a sleep study?
All right. So talk about the sleep study, because I know someone who's going in for one next week. What should they be prepared for? I mean, no matter where you're going, it could be up in Champaign, or generally, what should people be prepared for if they're going to do a sleep study?
Okay. Generally, spend the whole night there, of course. Bring pajamas to sleep in. And you're going to have probably 26 to 28 different wires placed on your body. You're going to have 6 of them on your scalp, and you're going to have them on your forehead, by your eyes, on your cheeks, and on your chin.
And people can sleep with that?
Yes.
Okay.
Yeah. It's amazing what your body can get used to.
So you come in, you get all hooked up, and then what happens?
And then we have you lay down in bed, and we always tell the patients you can turn whenever you want, but the sleep doctors do want you on your back as much as you can.
Okay. So you go through that, get up all unhooked the next day, and then what happens?
And then the way we do it at Sarah Bush is the study will be scored that day, then it'll be sent to our sleep doctor that day, and then you will probably hear something roughly within a week's time. We tell patients usually 14 business days, but you'll usually hear something back pretty quick. You really do.
So if your diagnosis comes back, you have sleep apnea, you're going to get something called a CPAP machine.
Yes.
So run us through the most common questions that your patients ask you about the CPAP machine and how it's supposed to work. And
how loud is it? And that's the biggest thing. And I'm like, well, your fan in your bedroom is going to be louder than what the CPAP machine is. And the other one is, well, I don't know if I can sleep with something on my face. Well, if you can do about anything, if you set your mind, go into it with an open mind that you're going to be able to do this, and it's going to improve your health overall. So you got to look at the big picture of it too.
Right.
So if you really want to do it, you're going to be able to do it. And it's not that big a deal. I've taken them home. I've slept with them.
So what is the CPAP machine actually doing for the patient?
It's acting like a splint for your airway. It's a little mask that goes over your nose, or one that goes over your nose and your mouth. And it just pushes air through your nasal and oral airway and keeps your trachea open. So that way you're breathing. You're not snoring anymore, and you're not having the apneas anymore.
So if people start on that and they're successful, will they see results like the next day? Or does it take a little while?
It's going to take a little while.
Okay.
I've had patients wake up the next morning and they're like, oh my gosh, that's the best sleep I've had in years. And other people are like, I really don't feel any different. But if you keep using it, I would say within 2 weeks, 2 or 3 weeks, you're definitely going to feel a difference. You really will, because you're going to sleep better.
So in the beginning of our interview, when we talked about your support group, they say they're always asking about the mask. What is the deal with the mask?
Oh, everybody wants the newest and the latest, like any of the
Okay.
cars or the cell phones, you know. I mean, they're always coming up with new masks and stuff like that. They're not nearly as rigid as what they used to be in the past when I started this. And then, so now they're coming out with some new full face masks that don't go clear up to the bridge of your nose. They're just going right over this part of your nose, and it still covers your nose and your mouth. So that's the newest one that's coming out this month.
So you had said that mask fit is very important. It's key to the whole thing.
Oh, it is. It is. If you get a mask that you just can't stand to have on your face, you know, and that's the one they used in the sleep study, in your titration study. Okay, it worked good for that night, but now you're at home and you put that thing on and you're like, well, this just doesn't feel like it did in the sleep lab. So you just toss it off into the corner. Okay, now you're not using it. Well, now you're not doing you're not doing yourself any good. You know, call the sleep lab or the durable medical company that you got your equipment from and ask them if you can try some different masks. Because we'll bring you in at Sarah Bush and I'll fit you for a different mask until we find one that you're going to be able to tolerate.
So there's more, I mean, it's not just here, you're stuck with this one. There's
Right.
many choices.
Oh, yeah.
Okay.
Yeah.
And people should, if they have the CPAP machine, use it every night, not just, I don't want to get a good night's sleep tonight.
Right, yeah, you shouldn't use it periodically. Well, I'm a little bit more tired, or I'm not nearly as tired. Use it every day. Even if you do take a nap, put it on.
And are
Put it on.
people typically good about using it every day?
Yeah,
Okay.
yeah, they really are. They really are. I
right.
mean, it may sound surprising that you're sleeping with something on your face, but once you start feeling the benefits of it, you're not going to want to sleep without it.
And taking on vacation and every
Right.
place else
Yeah.
you go.
Oh, yeah.
All right.
Yep.
Anything else we need to know about the CPAP or the sleep apnea you want to talk to us about?
If you got diagnosed with sleep apnea, use your CPAP.
There you go. Straight from Rodney's mouth. Let's talk just a little bit about, I'll ask you, you're a sleep technologist. What do you do to get a good night's sleep? Are you the poster child for a good night's sleep?
No. No. I do.
You have an odd work schedule.
I do. I work 2 nights a week and 1 daytime job a week. So, I mean, whenever I sleep, I tend to sleep better during the day because I've been doing sleep studies for 10 years. So I think I sleep better during the day anyway, but most people don't because we're built to sleep at nighttime. But I get good sleep. It's not perfect by any means, but I get good sleep. And I just avoid caffeine as much as I can is the biggest thing.
Really?
It really is, yeah.
Okay. He avoids it afternoon. I
Right.
usually stop at about 8 p.m., so I got to back mine down a little bit. What about, well, I didn't get a lot of sleep last night, and it's the weekend. Can I make sleep up?
No. Unfortunately, we can't. It feels like, oh man, I didn't sleep well. But I'll sleep in tomorrow. I'll make it. No, it don't work that way.
Once it's gone, it's gone.
Yep.
What about taking a nap? My dad took a nap at lunch for 20 minutes every day his whole career.
Nothing wrong with that.
Okay.
As long as it's okay with your employer.
Okay. Well, yeah, he would come home at lunch. Yeah, I
Right.
remember that as a kid. He'd sleep on the couch for 20 minutes and be out.
Yep.
But it's the time is critical, the length of time. When
Right.
does it become kind of not effective?
If you start sleeping an hour, then you're going to start getting into the deeper stages of sleep, and then you're not going to feel like you can function very well the rest of the day at all. But yeah, 20 to 30 minutes at the most.
Okay.
30 minutes at the most.
Okay, so we can't make up sleep, a 20 to 30 minute nap if that works for you, not at your place of employment, but
Right.
if you go home for lunch. We're not going to advocate for certain brands of beds, but we seem to see a lot of ads on TV for beds that are certain kinds of foam or that are adjustable.
Right.
Is that really important?
Yeah, it really
Okay.
is. It really is. I mean, because the more comfortable you are going to bed, the more you're going to look forward to going to bed instead of, oh, I get in that mattress again that goes in like this, and you just don't want to go to bed because you're going to be uncomfortable in that bed that you got.
So do those ones or even if you have pillows or something to raise, I've seen raise the head of your bed slightly is okay or is good.
Yeah, raising the head of your bed just a little bit is not a problem, and the foot of your bed's not a problem. The problem is when you start raising up to watch TV, so you can lay there and sit and watch TV for 2 hours.
All right. And what's the ideal position for sleeping? You've said
On
it.
your back.
On your back.
Your spine's in alignment.
Okay. Now, what's the worst?
Probably your stomach, because then your spine's curved.
Okay.
Or, well, yeah, probably your stomach, I would say.
All right. So lay on your back. Keep those naps to 20 to 30 minutes.
Right.
And as Rodney said, try not to drink caffeine after noon. I don't know that I can do that one. Well, Rodney, we're all out of time. Thank you for coming by our show and giving our viewers some sleep advice. And hopefully we'll be able to implement some of that. We can all get a better night's sleep.
Anytime.
Thanks.
Thank you.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center,